Hi again, ladies and gents. So I found one last presentation here. It's about cephalometric tracing methods. Né? So essentially what happens is we take an extraoral full radiograph of the patient. So that is our Ceph x-ray. Then based on that x-ray, either digitally, we're going to find landmarks, but I've discussed this in your lecture. We're going to find or identify specific landmarks that help us map out the patient's skeletal growth and any other skeletal discrepancies. Okay, so if you cannot do it digitally, normally we put tracing paper on top of our Ceph x-ray and then actually manually trace it out. Okay, so the second slide, the major landmarks frequently used, guys, very important. Nah? No slide 2 with your life, very important. Yeah, and then from there, from slide 3 going down, they're just basically explaining. You see all the landmarks that we identified on slide 2. They're basically just explaining what they are anatomically in a patient. You guys have done anatomy, you're still doing anatomy, so please just correlate it. So like with our sella, that would be the center of our pituitary fossa, and then with the nasion being the most anterior point on the frontonasal suture in the mid-sagittal plane, and so on and so forth. So please familiarize yourself with that as well. So that's basically what the next couple of slides are showing you. Go through that. ANS, PNS, subspinale, submentale, basal-menton, yes. All of those landmarks, guys, know them. Then from there, we are at slide number 11 of 24. At slide number 11, they talk about Ceph tracing. So remember, extraoral radiograph, I'm sorry, we're going to put tracing paper on top of it. So here they tell you that for soft tissue, they use a 2B pencil. So you know how pencils are like HB or B or 2H or 4H and so on and so forth. So for soft tissue, they're telling you guys to use, or for the soft tissue landmarks, you basically have to use a 2B pencil. And then for the hard tissue landmarks such as the nasal bone, maxilla, mandible, incisors, molars, etc., you make use of an HB pencil. This is what they're telling you to do. Or these are the pencils that you guys are taught to use, so I'm going to use them. However, I was taught that we trace with 2H pencils, so if you include that as an answer, I cannot mark you wrong, because 2H pencils, they're very light. So if you make, the argument is, if you trace and you make mistakes, it's easy to remove without actually damaging or dirtying the tracing paper, which is very important for record keeping. Hence, a 2H pencil is used. Oh, like I said, then the construction lines use a 2H pencil because it's very light. So yeah, they've already mentioned that. So yeah, I will not mark you wrong. Then from there, yeah, they just show you the tracing method. Okay, so those are relocation lines. And then, ladies and gentlemen, we have slide number 14. Okay, so slide number 14 talks about the tracing paper is attached with sellotape on one side only. You do not sellotape both sides or all 4 corners of your tracing paper, just one side, normally at the top. But point is, sellotape one side only. Okay, thank you. And then from there, very important, you have to include on your tracing paper the patient's name, date of birth, file number, if you guys obviously use file numbers at the practice, and then the date of tracing. This is very important because sometimes as you go on with treatment, the dentist or the orthodontist then can actually trace to actually see, trace again to see what has changed skeletally. So it's very important to keep track of all the dates that tracing has occurred. So please, you must know what needs to be on a tracing paper. And then from there, again, important, slide number 15, that you draw in your soft tissue profile with a 2B pencil. Okay, so now they're just showing you what goes where in terms of tracing. You can also go through that. They're showing you the nasion and basion and the mandible and the ANS and the PNS and all of those things, then your incisors and your molars. Okay, so now, yeah, all structures have been identified. Then the reference planes can then be drawn, and then the angular measurements are taken. So this is either digitally. If you guys do not have digital material, this is then done by making use of a protractor, like everybody else. A protractor can be found in our normal maths instruments that we find at the likes of PEP, Checkers Hyper, etc., etc. And then from there, we analyze and interpret the measurements that we have received based on our Ceph radiograph. Okay. Okay, so then they just show you the reference planes. You can know that for me as well. Soft tissue analysis, and then from there a basic stun analysis. So slide 23 just shows you what a Ceph X-ray or your tracing probably looks like once you're done with all your angular measurements, your millimeter measurements, your reference plane, as well as anatomical landmarks. So that's basically what we expect you guys to know. That's it when it comes to tracing papers. Next. With a Drake and a spray copy, Chicago. I was straight through the door with my